I'm Dr. Anthony Kaveh, and this doctor here is going behind bars. Dr. Benjamin Brown did what I would consider the unthinkable and put his own wife into a coma. Now, everyone always asks me, is this an intentional medical issue? Well, you'll tell me at the end of this. That's Benjamin Brown. That's his wife, Hillary, former wife. And that's him actually as a doctor. He's no longer a doctor after this. So it's not the first time someone has cut corners with trained anesthesiologists. Michael Jackson is the classic example of give me mo milk. Now that was propofol. This is a whole different medication overdose that led to this horrible, tragic accident with lidocaine. And I'm going to walk you through the story. You're going to learn all about it, and more importantly, what to look out for if you are considering cosmetic surgery, especially anything relating to liposuction. So Benjamin Brown was performing a procedure on his wife, a couple different procedures, including a scar revision and liposuction. Now, Hillary was trying to be proactive from the reports that we have from the medical assistant that was present. She prepared her own IV bag. And by the way, I'm going to be very clear that there's different types of IV bags. It's very misleading what's going on here. Because the IV bag that you typically think of that goes in one's vein is not the same type of bag that's used in liposuction, where that tumescence, that solution in the bag, does not go into your vein. It'll kill you very quickly if it goes in your vein. It goes into tissue planes to expand them and to anesthetize them. She was also given some pills, and we believe, though we don't know for sure because they were never documented, that they included Zofran, Tramadol, and Valium. This is a typical concoction for what's used in plastic surgeries when an anesthesiologist is not present. Hillary was trying to be proactive, and sounds like she was suturing her own wounds. But at some point during this procedure, she became restless with twitching muscles in her feet, eventually visual disturbances, and then she developed seizures at some point after what seems, based off of the medical assistant's testimony, to be ignoring anything from no action taken by Benjamin, who continued to inject the contents of that bag. Once again, not in the IV, but likely into the tissue planes. The problem is that after having seizures, which eventually led to cardiac arrest, and I'll explain exactly how that happens, the medical assistant said we should call 911, but Dr. Brown wanted to do it himself, quote, and wanted to wait, and it took about 10 to 20 minutes before Brown asked for 911 to be called. When she showed up into the hospital, she already had elevated lactic acid, which is a marker of your cells effectively dying because they're not getting any nutrients from blood flow. They produce lactic acid, and they suspected lidocaine toxicity, like the vial of lidocaine that I put there in the picture. Now, Hillary was in a coma during this time and stayed in a coma for the rest of the week. While the final autopsy report is pending, I want you all to know that this is more than likely related to local anesthetic systemic toxicity, or LAST. So I want to look at the comments. Everyone here is correctly concerned about what is going on. Who here, hey, Cynthia, shout out to you for making your first live. Yeah, if you're talking about the Dr. Brown in the photos, it did look quite sketchy to say the least. Now, I want to know who here has heard of local anesthetic systemic toxicity, and I'm going to tell you what you need to look out for to minimize the risk of this happening to you, even if it's not your partner who's doing the surgery on you, but if you're a patient in what seems to be a normal office. Suffice to say that the medical clinic that Dr. Brown operated is permanently closed, as listed on Google. So that part of his life is done, as is his medical career, because it sounds like the state of Florida has suspended his medical license. Local anesthetics are a fascinating group of medications. We use them here in the operating room all the time. And I know that some of you guys are aware of it, like Carrie Z says. And hey, Ivy, good to see you here. And Neuropilot has also heard of what happens if lidocaine gets overdosed in a patient. So the issue is that all local anesthetics act on nerves, and there are nerves everywhere in the body. There are many ways of delivering these nerve modifying medications. You can give them just straight into like your skin to anesthetize the skin and some of the soft tissue, similar to what happens in liposuction. You can give them epidurally through the intrathecal space in what's called a spinal. You can do nerve blocks like you've seen on my other videos that I do in patients every day practically. You can also give them IV, you can also give them intravenously, but that is really, really rare and you need to know what you're doing. Anesthesiologists are some of the few doctors that will ever give a local anesthetic in the IV. You have a very, very, very narrow range of error. For those of you that are interested, I put the doses here. Depending on whether you use epinephrine or not with lidocaine, you can give more because epinephrine slows down the uptake of lidocaine so it doesn't overwhelm the two most important organs in your body that are highly dependent on nerve activity. If you are giving tumescence, you can give a much higher dose, 35 milligrams per kilogram. But the point is that your heart and your brain have the most nerves in them. And when we give medications that disable the sodium channels of those cells to help numb ordinarily we think of just numbing the skin, but you can effectively numb your brain and numb your heart to cause all sorts of arrhythmias and to cause seizures, because these two organs in your body are going to be the most sensitive to local anesthetics. And if we give too many of them, you have local anesthetic systemic toxicity. And the problem when you have an unscrupulous individual using large doses of lidocaine, you can overdose a patient. I'm looking at the comments here and I see that Christy as a circulator is very, very cognizant of the tumescence used in plastics cases. And yeah, you're correct. This case is interesting, but not in a good way, unfortunately. So I want to make sure you understand that this is very safe if you have a professional who is monitoring the patient. Namely, you have an anesthesiologist who knows what to do if there are any early signs of local anesthetic systemic toxicity. That's why I had this milky bag here at the beginning of the case. That's why I have a breathing tube here. So this is intralipid. This is an endotracheal tube. In case you haven't seen one, it goes into the back of your mouth here to support your breathing when we connect you to a ventilator like what you see behind me. If you have local anesthetics that are too high in your brain, the concentration is too high, it will cause seizures. For example, you're doing liposuction, you accidentally inject a whole bunch of lidocaine into a blood vessel in your belly or wherever else in your body you're doing the surgery. That leads to a massive concentration in your blood of lidocaine that rapidly reaches your blood-brain barrier and it crosses it and then can cause the nerves in your brain to go haywire, leading to a seizure. When you have that seizure, you are not protecting your airway. We need to place that breathing tube. If it reaches your heart, the nerves in your heart go haywire, and you can have all sorts of arrhythmias, ventricular tachycardia, ventricular fibrillation. We need to give intralipid as fast as possible to literally diffuse the local anesthetic away from the sodium channel receptors in your heart so your heart can begin to beat normally. There are nerves all over your body, but these two organs are going to be the first to respond. It's kind of like the canary in the coal mine. Most anesthetics will cause seizures before heart problems. There are, of course, many exceptions. So the treatment for these is key because you don't treat them like you do a normal cardiac arrest, because the source of the cardiac arrest is very different than a heart attack or bleeding out or electrolyte abnormalities, which go through the typical ACLS protocol. When you have somebody with LAST, you need to begin performing CPR immediately while you infuse intralipid into their vein ASAP. You need to have an anesthesiologist to really run the show. If you, as the proceduralist, did not want to pay an anesthesiologist because you wanted to do it all yourself, what happens if in the middle of the surgery, suddenly that patient begins to report problems of LAST manifesting in their brain? Well, the answer ain't to continue doing what you're doing, which is what happened in this case, according to the medical assistant that was present. There was no anesthesiologist, to our understanding, to our knowledge, to help stop what was going on, provide intralipid, provide other medications to help support the heart. Instead, they continue to inject lidocaine, which is only going to further increase the blood and therefore the brain levels of local anesthetics. So you need to have someone trained on how to treat this immediately, because seconds count when you're having a seizure. If you vomit and suddenly aspirate. Remember at the beginning when I said that they were given a handful of pills? These are common pills that are given in cases when someone is not bringing on an anesthesiologist. Of course, it costs money to have an anesthesiologist. People cut corners. You don't give somebody oral Valium, oral Tramadol. It's that opioid agonist, synthetic. You don't give someone oral Zofran if you have an anesthesiologist, because the anesthesiologist is giving everything through the vein or through gas to help safely keep someone comfortable. The unfortunate truth is that if someone is trying to do a surgery cosmetically without an anesthesiologist, they will give so much lidocaine to try to numb up the patient that they risk bumping into that higher level of the 35 milligrams per kilogram. And that is how cutting corners can cost lives. We went through a lot of information here. I want to open this up to questions on your end. If you're learning something new, please hit that like button and share what you've learned with others, because this case can happen to anyone if you don't have a trained professional in the room to help monitor your body when you're having cosmetic surgery. That's why we strongly advocate for there to be an anesthesiologist present. Look at Michael Jackson, if nothing else. No anesthesiologist, along with inappropriate use of propofol in that case, very different than local anesthetic toxicity, but nonetheless, cutting corners is not the right answer. I want to make sure that we acknowledge, hey, ARCChem, Air Force EMTs are absolutely fantastic. They know a lot of this stuff. Kathy Jennings, you are so welcome. Mitchell Pilot, how does general anesthesia affect an unborn child? Hugely important question. It has the same effect on a child as it has on the adult. If a baby is delivered with anesthetics given to the mother, that child might come out with respiratory depression or signs of being under anesthesia effectively through the placenta. Laura, how do you know if you have a good anesthesiologist? Ask your surgeon how often they've worked with the anesthesiologist. You can speak with them and making sure that they are board certified. You can ask where they went to school. Hey, you're so welcome, Nancy. Does Versed kill brain cells? Not to our knowledge, but certainly midazolam can have many long-term complications if used chronically. Remember that you have more power over your health than you've ever been told. Please, if you're looking at cosmetic surgery, ensure there is an anesthesiologist present. If there's liposuction being used, or if it is something that you need to speak with your general doctor, they recommend having an anesthesiologist present. Cutting corners can only cause problems in these sensitive cases.